Let's go back to Zen charts. So I'll cancel this. And remember, show all forms. So we'll see what we have. Pediatric symptom checklist. You did that when you did the intake with mom or dad or caregiver authorization within did intake, ROI, and informed consent. So we'll go to face sheet. We're going to add a form. So let's start doing an assessment. Now, Brett and I, as you know, I believe, did a long assessment, but this is just to introduce you to the form, okay? So same thing, right? Clinical assessment, add form. All right, so this again, you would probably do with the parent or the caregiver. The same you did the PSC, you would do the same thing here. And you know, these take a little bit of time. It's not gonna be super fast, so hang in there with me on this assessment. And again, this is just like the basics of how to do the form. This is not how to do an assessment. That is a completely separate video and training, which you'll do live with us, but I just want you to see the form, okay? All right, so the date of the assessment is today, let's say. Puff the dog. And we've learned about Puff the dog, you know, just generally that Puff has some anxiety issues, some separation from caregiver issues, and some impulsivity, right? So these are kind of the things that that Puff is dealing with in school. And again, it doesn't matter, you know, I'll say Caucasian, that's what I name of legal guardian. We'll say Martina Wilson. Puff is 20 years old. Okay, that's incorrect. Oh, that's right, because I put his birthday was 2000, whatever. Puff is 7 or 8 or something. Parents, so, all right, so this is where you want, and you can do this with the parent. So you can say, okay, mom, dad, caregiver, what's your name? Martina Wilson. Does Puff have any siblings? Yes. Max the dog. What school? We'll say dog school. And what grade? I don't know. 5th grade, all right, grade 5. Who is the primary caregiver? So let's say in this case, it is the parent. You could say other. Legal guardian, let's say, is the mother, and you could say the father, right? But if it was a caregiver, you might have CWS, probation, conservator, grandparent. All right, special need. Does Puff need anything? You know, and if they wear glasses, or, you know, I may say something like that. Any mobility, is a child in a resource, or things like that. You could put, they have an IEP or a 504 plan, which we'll talk more about training. But for the just simplicity of this particular form, I'm going to say none. All right, presenting problem. And you can write a lot more, you know, than I tend to write minimal amounts. So what is the presenting problem? And so this is what Brett is going to talk a lot more about. But why is Puff in your office, right? So some behavioral stuff, and don't say stuff, but, you know, some behavioral issues, and he has separation. So unable to enter classroom without parent, right? So that's the challenge that you're, you know, the school's coming to you, they're saying, oh, you know, can you take this kid because this child doesn't want to go to the classroom. So there you go. That's what the presenting problem is unable to enter classroom. So what are the symptoms? Well, you know, tearful escalations, Puff is howling, barking, let's say refuses to leave vehicle, I'm a terrible speller, holding on to mom, somatic complaints, you know, a number of things, you know, you could put there, the symptoms. And in great thing about Zen charts, it says clinically significant symptoms present during the last 6 months appeared or changed significantly recently. Symptoms have previously present, but not in the last 6 months. You could say vomiting prior to school school arrival, sadness, stays in room alone, refuses to play with others. I don't know, right? You know, these are just things that are, okay, so how is that impairing Puff's life at school or at home? What are the functional impairments? Well, and again, Brett's going to go over this, but let's just say educational. We're having some educational issues, right? Because the fact that they are tearful, they refuse to enter the classroom, that means they cannot attend school regularly, so they probably have a lot of absences. Yeah, again, my spelling is terrible. What about physical? Any kind of physical, social? Social, yeah, no friends, right? Lack of positive peer relationships. Okay, so and there's 4 of them. I'm not going to go over those because it'll take a little bit longer, and that is what Brett's going to do. Okay, because he's a great at doing assessments. But you know, how are these symptoms impairing your client's life? And that is just 2, educational and social. Okay, and there's more, but we'll keep going. Risk assessment. Well, when I'm doing a risk assessment, you know, I'm looking for self-harm, maybe any substance use, etc. And at this is a young age. This particular, you know, I'm not at the moment. I'm not seeing none at this time. I'm not seeing anything, but you may be seeing something. Mental health history. Okay, well, this is why we want mom involved, right? Mom has history of substance use, abuse, and depression, let's just say. Okay. And again, you could write a lot more than this, right? But I tend to, if there's no substance use or abuse, you don't want to. But if you wanted to, you could add a substance, and you could add information here. Click on the substance, heroin. Mom was, you know, addicted to heroin, and you could say IV drug use, intravenous. You know, you could first age of use, 13. Blah, 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 last use, whatever, add substance. Okay. Now this was the mom. This is not the child, but I'm just saying if you were going to add something about, I'm going to actually delete it because the child did not use it, but if you're going to add something about the substance, that's where you would put it. But for this particular child in the assessment, there is no drug use, so I deleted that, but just FYI. Even though I said mom, I realized. Okay, so developmental history. Well, mom used substances during, I don't know, maybe mom told you, maybe you got that out of mom, during first trimester. Maybe, prior to knowledge, right? Prior to knowledge of pregnancy. Physical health, healthy. Allergies, any allergies, peanuts, whatever, right? You would add that here, same as the substance use, click and add. Any current medication. So is your client on medication? This is really great to know. If mom told you, if you didn't get to the question, or I don't know, didn't come up and you don't know, you can click unknown. And then if you say yes, then you can provide information below, right? But I said unknown. Okay, any legal stuff happening? So is there a restrictive order with one of the parents or anything going on around those? And I'm just gonna say none, but if there was, you would put that in here. And again, Brett's gonna go over this in more detail. Cultural and social factors and functioning. Well, what's going on at home? So for this one, I like to say, single parent household, or grandparent household, involved in puppy training class with parents. There's, attends dog church, has close family bonds. Oh, goes to dog park, right? Something like that. I don't know. Goes to doggy park. Okay, and maybe takes if it's a kid, a dance class or something. What's happening with school? And this is where you would put more information about school. Obviously, school is where we're seeing the behavior. We're not seeing it at home because we're not at home, but we're seeing it at school. So what's happening in school? Lack of motivation, fear of, I don't know, let's say not completing homework, whatever may be coming up with the school, excessive absences, okay, things like that. That's where, when we talked about the functional impairments, okay, how is this affecting school and work, school or work, school. All right, add history. Okay, sorry. Schoolwork. So whatever is happening in the school, in the classroom, that's what you're looking at right there. Now looking at family history, this can be really, really valuable and important when we're doing your treatment plan and you're helping work with this kiddo, is you can add any relationship, family relationship. So you may know that dad is alive, but has some mental health issues and additional alcoholism. You may know that he is inactive in the child's life and problematic, right? As evidenced by when dad comes home to visit, escalations in classroom and at home per mom increase, right? I mean, there you go, perfect. And you could add a lot more, but that's helpful information for you. Family or support. Okay, now up here we talked about kind of where are they in the cultural and social. You could say high, medium, low socioeconomic status, etc. But family support, this is really important. So when your kiddo or your student, or however you want to think about your client, is not in the classroom or in your office, where and who supports them? Okay, so this is where you'd say mom, grandma, church, doggy park, whatever your kid is doing, right? So these are the strengths. You could have a strong family bond with grandma, right? Active in community, I don't know, whatever. So you would add kind of the things that you got from mom. What are the client's goals? Well, a lot of times the clients are not, especially the younger ones, may not have goals, but so you could parent, or what do you think that really, or teacher, you'll get it from lots of different angles. Generally, we would like, the goal would be for Puff to attend class regularly. The goal, this is like the overall kind of goal, have friends, enjoy school experience, right? Something like that. That's what we're thinking. Don't look at my spelling. What are the client strengths? Oh, well, this client has a great, friendly, personality, outgoing, intelligent. Every client has amazing qualities. Every student, everyone we work with is amazing in their own way. And so that's your job, to kind of figure it out. And then maybe encourage, because it says in the client's words, encourage them to find one or two things. And sometimes that's really challenging. So you could help a little bit, but what do they think? And usually they can come up with at least one thing. I'm really good at X, Y, X. Okay, so your MSE mental status exam. Appearance. Puff the dog is dreaming. Did you hear that? Older than stated. General, these are all these. So I usually, unless there's something else, I say dress and grooming appropriate. Eye contact, did they make eye contact? Good. Normal for speech, normal for age and situation. Attitude, responsive. That means when I ask the question, they, right? Behavior, pretty normal, and there's again, Brett's going to go over all of this stuff, but these are just so you get an idea about the form. Mood, pretty happy, right? Normal affect. Well, in this case, I guess we would say maybe anxious, maybe fearful, sad, tearful, right? I forgot. Right, and again, you're going to go over this with Brett. Perceptions, any hallucinations, no. And with our clients, really, most of the time, it's going to be normal, unless they're, you know, on like a meth psychosis or something. You get them at that point, but you probably won't. Linear, rational thoughts, are they? You know, again, most of our clients will be there. Thought contact, pretty normal. If they have obsessions or delusions, I don't know. And now, again, this is important if they're having any SI or intent. It's good to know harming others. Oriented to person, place, time, so that they kind of know where they are in time and space. Alert, you know, again, you're just going to keep going. And again, Brett will go over this stuff. So here's where, and again, Brett's going to talk about diagnosing, but this is where you would add that in. So let's say, what did we say? We said separation anxiety, right? Diagnosis for Puff the Doge. All right, so we said, let's click on anxiety disorder, right? What's the diagnosis? So you can put in F. Oh, look, everything pops up. Oh, let's say a separation anxiety. Let's just say that. Or we could say a situational, but I don't know. We'll just say that one. And then, you can specify, or you can just leave it. I leave it as primary. And again, you can always go back and modify. What are your impressions? Puff was tearful upon entering office. You know, and so what did you see? What do you think as a clinician? Significant changes? Well, none, right? At least at this point, because you just met in the treatment recommendations. Well, I'm going to work on gradual exposure to classroom environment, whatever. You know, what are you going to do? You're going to see plus weekly appointments. Okay, appointments. All right, save. Very important. Save. It will automatically save. This is probably one of the longest videos. Oh, we did all this great stuff. Boom, 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 boom. Signature. This is your signature. T signature. Remember we set this up? Continue. Therapist. Sign and finalize. So you finalize this assessment for your client. Okay. Now, let's return to face sheet to confirm. My battery's about to die, so I'm purring a little bit. And let's go to show all forms, and let's confirm. What do we have here? All right, so clinical assessment pending review. That's totally fine. That one of us was going to review that you completed it, and I will give it a little check. But basically, you're done. When it's done, it'll say completed. Okay. All right. So we're done with that one. I'll see you in the next video.